Thank you very much for joining me for the Dental Fee Negotiator webinar. My name is Tim Court, and I'm a practicing dentist in the state of Wisconsin. Many years ago, I got fed up with my reimbursements from the dental insurances. Many of us might hate these insurance plans, but unfortunately, we all know we have to play the game in order to get new patients and to retain our current patients. I decided to then take the other end of this spectrum and try to negotiate with them, which sounded crazy years ago. After years of trial and error, I was able to make some headway and create an actual system. I saw some really quite large increases, which allowed me to go from one practice to almost 14 dental practices in only 6 years. My increases were to the tune of hundreds of thousands of dollars a year. Pretty amazing when you know that you don't have to get another patient, you don't have to drill another tooth, and you really don't have to worry about one more upset patient. I'm only saying this to show you that there's a lot of opportunity here, and you are not getting paid for what you should be. My team has swelled from myself and really my office manager, so it's a two-person team, to over 20 people who are well-versed on many facets of negotiation. I'm excited to share our process with you and help you achieve the success that you deserve. Now, this will be a 40-minute presentation right around there, and it's almost like a college course that covers and summarizes almost 4 semesters worth of fee negotiations. So this mini course that we've created just to show you how we do our system, and maybe you can do it too. Stay for the end, though, because we will discuss how you can get more information about us and how to get our free insurance profit recovery kit. I would like to now pass it off to one of my esteemed colleagues who will discuss how we are able to increase most dental offices, their reimbursements from almost 10 up to 40%.
Thank you for that introduction, Dr. Quirt. Now, negotiating with insurance companies often seems to be a foreign concept to many dentists around the nation. But we're here to tell you today that negotiating with insurance companies, particularly on the fee schedules, is definitely possible. Please visit dentalfeenegotiator.com for additional information. Now, as we go through this presentation, if you have any questions, please email us at dentalfeenegotiator@gmail.com, and we will try to get to your answers as quickly as we can. To begin this 40-minute presentation, I'd like to start out with a simple analogy about the National Football League and their money, or at least the revenue that's funneled through that industry, as it relates to dentistry and individual dental practices. Do you remember this Super Bowl? This Super Bowl was Super Bowl 34, and it was the St. Louis Rams against the Tennessee Titans. The interesting thing about this game is that this game came down to the wire, where the very last seconds of the game determined the outcome. If you remember, Kevin Dyson here in the blue jersey just came inches short of the goal line on the very last play of the game as the clock expired. Literally inches short of the goal line. Do you know what that cost the Tennessee Titans? Do you know what that cost the individual players that put in all that effort to try to win this game? Well, I will tell you that the MVP of this Super Bowl, Kurt Warner, who played for the Rams, was awarded a $1 million bonus for winning this game. Now, back then it was a $1 million bonus. Today, Super Bowl MVPs get anywhere from a $5 to $10 million bonus, including endorsements, including salary renegotiations the following year. I mean, take a look at Joe Flacco. Joe Flacco got a $120 million 6-year contract, and that followed his win of the Super Bowl that occurred earlier this year, 2013. Now, if you think about the inches in a football game and how that relates to the inches in a dental practice, well, I think the answer is obvious. The inches in the form of write-offs that you're giving away on a daily basis, an hourly basis, and if you boil it down to the seconds and minutes, every procedure that you perform on an insured patient costs you money. And if you add those pennies up over time, it is thousands upon thousands of dollars worth of pennies in the form of insurance write-offs. Well, I'm here to tell you today that we need to put a stop to this write-off practice. Now, here's an example of PPO write-offs in a few states. In Arizona, the average PPO write-off is 37%, Nevada, 35%, and then in the state of Utah, 39%. Where do you practice? Well, I was recently in Pennsylvania, and the average PPO write-off there was 39.4%. Now, folks, the purpose of this presentation is to give you the knowledge on how negotiations could be done. But like Dr. Quirt mentioned, this is a 4-semester college course that we are going to condense in a 40-minute presentation to give you a general sense of how expert negotiators negotiate with insurance companies. The second thing is I want to give you the courage. A lot of doctors that I know of, at least, that try to negotiate with insurance companies are intimidated. They think that insurance companies are the giant, the 800-pound gorilla that's in the room. They may be the 800-pound gorilla, but the reality is there are things that you can do effectively, or there are people out there that know how to do this effectively, that will allow you to negotiate increased income for the practice. Now, we have a 7-step proprietary process that we use to negotiate, and we're going to go over that today. I also want to share with you some basic negotiating tips. Now, negotiating is a skill set. Much like dentistry, you have to acquire and learn, and sometimes even spend money to learn basic skills in negotiating. We're going to go through both basic and advanced skills in negotiating. Hopefully, you'll be able to apply some of those tips in your day-to-day living. And then the last thing I want to do is I want to give you the motivation to do something at the end of this presentation. So let's get right into it. If you think about the skill set of negotiating, think for a minute of who the most effective negotiators are that you know of. I think 2 types of individuals come to mind immediately for me. Number 1, politicians. Number 2, lawyers. I think most politicians are lawyers, and that should give you an idea of effective negotiators. Unfortunately and sadly, a lot of these politicians have negotiated great salaries for themselves to do nothing in Congress. The do-nothing mentality is certainly something that I don't want you to think about when it comes to negotiating. You can be effective at negotiating, and you can be productive at the same time. But negotiating is tough, folks. It's not an easy skill set. To illustrate my point, if you remember this case back in 1994, yeah, some of you might be thinking, yeah, well, OJ ended up in jail anyway. But back in 1994, court of public opinion, OJ was guilty as sin. However, OJ hired what the legal profession refers to as the dream team in the legal industry to represent him. And he spent about $6 million out of his own pocket to hire this team. The end result was he was acquitted of murder. Walked scot-free for what we all thought a murder he committed. Fast forward to a couple years ago, Casey Anthony. Now, she didn't have money to hire a dream team per se, but I think she got really lucky because she ended up having a guy by the name of Jose Baez who negotiated a great deal for her and essentially helped her walk scot-free from a murder the entire nation knew she committed. According to the evidence, everybody thought, yeah, Casey Anthony is going to go to jail, but the end result, Jose Baez was such an effective negotiator that he convinced the jury that there was not enough evidence to convict her. Well, the state of Florida spent millions of dollars on this case, but if Casey Anthony were to hire this team here, at least this guy here, this man here, Jose Baez, according to his price tag of how effective of a negotiator he is after this case, she would have paid at least $2 million. Now, the most recent case. This is Jodi Arias, the case out of Arizona. Jodi Arias was accused of murdering Travis Alexander, and she actually admitted to it. But this case is so similar to the previous cases in that the court of public opinion, just with the evidence that was discussed in the courtrooms, everybody knew that Jodi Arias was guilty of sin. But do you remember any of the names of her defense team members? I don't think so. Do you remember the name Juan Martinez? I think most of the people that I've asked that question to remember Juan Martinez because he was such a loud and effective attention getter, effective negotiator. Well, the state paid well over $2 million prosecuting Jodi Arias. The end result was Jodi Arias was convicted of murder. The point here, folks, is that the best advocate will always win. If you think about the sports industry just for a second, the name Scott Boras comes to mind within Major League Baseball because Scott Boras is the most effective and most popular sports agent for Major League Baseball players. Back in 2010, Scott Boras negotiated $701 million worth of contracts for these 4 players here. Do you know what his commission structure is like? Well, Google it. You'll find that Scott Boras makes a lot of money. Very effective negotiator. Take a look at the NFL. The most effective negotiator in the NFL is a guy by the name of Tom Condon. Everybody hires Tom because he's such a great negotiator. Heck, he has Peyton Manning, Eli Manning, Matt Ryan, and Jake Long back in 2010. With these 4 players, Tom negotiated $326 million. And these are only 4 of hundreds of players that have hired Tom to represent them. The point that I'm trying to make here, folks, is that the best negotiator will always win. Think about who your negotiator is when it comes to insurance companies. I think the ADA does a decent job. Some of you might be shaking your heads and saying, no way, hey, the ADA doesn't do anything. But the ADA actually does do some things on the contract side between the doctors and the insurance companies. And a good example is the non-covered service law that was passed in 31 states over the last 2.5 years. But when it comes to fees, the ADA cannot get involved simply because it's against antitrust for the ADA to negotiate rates. When it comes to collective bargaining and fees, when dealing with multiple private dental practitioners, it's against antitrust for the ADA to get involved. So the big question mark is, who's your representative when it comes to fees? Now I'm going to share 7 steps on how we negotiate, and perhaps this is something that you may apply on your own. I will throw a caution sign out there. There's a lot more to negotiating and a lot more to fee negotiating within dental practices than what we're going to share today. My hope is that this information will at least enlighten you, at least give you a sense that negotiating with insurance companies can be done. So step number 1, building your insurance profile to me is sort of building a SWOT analysis of your practice. Identifying what the strengths, the weaknesses, and the opportunities and strengths are, at least for your insurance department. So let's get right into it. So the first part of building your insurance profile is organizing a list of all the PPOs that you have entered into a direct contract with. Some of you may have contracted with Aetna indirectly through Connection Dental or through Assurant. What I want to do here is I want to identify the direct contracts that you've had with any PPO or all PPOs that you're contracted with. The reason why this is important, folks, is because every 2 years, insurance companies will allow you to negotiate. So not only do you want to identify which PPOs you're contracted with, you also want to identify when the contract date was with those PPOs. Here's a list of PPO companies that do negotiate every 2 years. Blue Cross in some states, MetLife will negotiate in some areas in some states. Same thing with United Concordia, but this list at least gives you a general sense of who the national players are that will negotiate every 2 years. The second part of building your insurance profile is facing the reality that your practice may need to join a few PPO plans just for the sake of filling that empty chair time. I'm not here to advocate for the PPOs, but the reality is that our industry has shifted so much away from fee-for-service, and the insurance companies have done such a great job at forcing a dependency not only on the public, but on medical and dental practitioners in general to enroll and be contracted with PPO plans. Because the reality is, folks, patients just don't schedule with us when we're out of network. What happens when a patient calls your practice and asks, are you in network with Cigna? Your front desk says, we do file all claims for PPOs for you. Go ahead and come in and we'll take good care of you. The patient follow-ups and says, actually, I need to know whether you're in network or not because I just can't afford to see an out-of-network dental practice. Your staff member has to respond and disclose legally that you're not in network. No, we're not in network, but we will file your claim for you. What happens next? Click. Patient hangs up and calls the next dentist on Yellow Pages or the next dentist on their Google search. The reality is that you just lost the patient. Now, for those of you that have a lot of chair time to fill, Howard Franz says this in his seminars. Having somebody in that dental chair is far better than not having anybody there and losing money on lost opportunity. Seriously consider joining new PPO plans if this is something that you need to do to drive new patients. Now here's something to consider, folks. The ADA says that 73% of all active dental patients have a third-party payer source. What does that mean? Essentially, that means 73% of all patients either have a PPO plan, an HMO plan, a discount plan, or under a Medicaid or Medicare plan. The ADA further says that 92% of all dentists out there are contracted with multiple PPO plans, meaning 92% of dentists are, for the most part, in-network participating dentists with a variety of PPO plans. And that only leaves 8% of the doctors out there that are truly fee-for-service. If I were to look at these statistics 5 years ago, that 8% would be closer to 15 to 20%. The reality, folks, here is I'm not trying to scare you, but the reality is that the industry is changing. The industry is shifting in the direction of PPOs, much like 30 years ago when your medical doctor colleagues were consolidated into the hospital systems under managed care plans. The same trends are occurring in our industry, and whether that's good news or bad news, that at least tells us that PPOs are controlling where the patients will ultimately end up for their dental treatment. So that's one of the major reasons why considering joining PPO plans is important. Now, if I can teach you, or at least give you a resource on where to go to help negotiate fees prior to joining plans, PPO plans that is, that at least helps you reduce the burden of write-off when you do join a plan. A lot of folks say, yeah, insurance is the lemon that we were dealt with in our industry. I'm here to tell you that there are a lot more lemons in the dental industry than just insurance companies and insurance write-offs. This presentation will at least give you a sense or a solution that reducing those write-offs is something that's possible. So to continue the thought about considering which plans to join, I think your front office staff members might know best which plan that they think you should consider. So here are a list of questions that you might want to ask your front office staff members. Do we need to sign up for more PPO plans? If so, which ones do they recommend? A key question is, are we losing patients as a result of being out of network? Most dental practices don't track lost opportunity. If you feel like you're losing patient opportunity because you're out of network, start tracking those numbers. For a lot of practices, they're actually alarmed that they're losing 15 to 40 patients a month by being out of network. Imagine what 15 or 40 new patients would do for your practice today. So, follow up with your staff members, ask them these questions. They will likely know best or likely have answers to these questions, which will steer you in the right direction of which plans to consider joining. Another part about why in-network participation on the part of dentists is important. Have you ever asked your patients if they budget for dentistry? Think about this question for a second. What is the average family annual budget for dentistry? Now, you as a dentist might say, well, I'm a dentist. I don't budget for dentistry because I can perform dentistry on all my family members. But think about the average person out there. You know, when we polled over 500 individuals, they gave us this answer. They don't budget for dentistry. I don't think anybody budgets for dentistry. So what does that tell you about the mentality when patients search for a dentist? Number one, they don't really have any money to pay for dentistry, or they think they don't. Number two, it's all about cost. In-network participation to the average insured patient equals savings. And that's the main reason why they won't schedule with you if you're out of network. Another part to consider about which plans to join is understanding the leasing arrangement that insurance companies have with one another. Now, some of you already know that when you join Principal, that may also put you in network with Emeritus under the Principal fee schedule. If you join Aetna, that may place you in network with Assurant or Dental Health Alliance under the Aetna fee schedule. At the very beginning of this presentation, I mentioned that you want to identify the direct contracts that you have with each insurance company. And here's the reason why. You might be contracted with Connection Dental only, and that'll place you in network with almost all of these plans here, depending on which state you practice in. And this is important because if I can get a higher fee schedule from Connection Dental than I can get out of Principal, well, then I'm certainly going to go ahead and only join Connection Dental. So folks, this is a little bit complex because in certain states, this list is actually double. So what I recommend that you do is visit our website, dentalfeenegotiator.com, or send us an email, and we can help you navigate which PPO plans to join, which ones you don't want to join, and what the best financial benefit might be in creating a solid and profitable PPO structure in terms of joining new PPO plans. Now, the third part of building your insurance profile is you want to identify your style of dentistry as it relates to billing. Most general dentist practices have 30 CDT codes that represent 90% of their revenue. So when it comes to negotiating a fee schedule, focus on the fees that matter the most. There are over 300 CDT codes on a fee schedule, and if you focus on the ones that don't give you profit, you'll be spinning your wheels when you negotiate with insurance companies because on their side, their tactic is let's give you increases on procedure codes that you don't regularly perform. The other part of identifying your top 30 most productive or most profitable codes is that you also want to identify the alternative benefit procedures. Have you ever submitted a claim to an insurance company and you got the EOB back that said, no, we're not going to pay you on the posterior composites. Instead, we're going to downgrade those to amalgam. So you perform the white fillings or the composites and you actually got paid on the amalgam. And that, for some dental practices, is a 30 to 60% reduction in income. What you want to do here is you want to make sure that you also negotiate the alternative benefit procedures. The main alternative benefit procedures that come to mind are the 2100 amalgam codes and D2791, which is the base metal crown code. Whenever you submit any crown to an insurance company that's not a base metal crown, more than likely that insurance company will downgrade that crown to base metal crown in order to help that insurance company save on costs. And that applies only to in-network doctors, because when you become in-network, you give the insurance company the right to play that downcoding game. Now here's an example of a fee schedule that was received where the amalgam codes were ignored. You see here that the one surface, $70, and then the one surface on the posterior here, $86. Not that bad of a difference, but the point here, folks, is that you want to make sure that you compare these fees to make sure that it's not a steep discount if the insurance company decides to downgrade on you. Now here's another example. Here are the crown codes. What's missing from this fee schedule? This was an actual fee schedule offered by an insurance company. Now this porcelain crown code here actually started at $530. We were able to increase this to $810, but what's missing from this fee schedule? If you look closely, $27.91 doesn't even appear here. So it's great to have this $300 increase on this porcelain crown, but if the fee schedule does not have $27.91, you need to go back to that insurance representative and say, hey, I didn't see $27.91. That's an important code for our practice. What are you willing to pay for that? Well, when we went back to this insurance company, asked them to add $27.91, that fee came back at exactly where it was before, which was $491. So the $300 increase here becomes obsolete because the insurance company knows that if you agree to a lesser $27.91 fee, that insurance company essentially will have the right to pay you on $27.91 for any crown that you submit to them. So that's why this part is important, folks. Did you know that 40% of your insurance revenue is subject to be downgraded? And amalgams and base metal crowns are only half of the story. Keep in mind when you join an insurance company as a new provider, or if you're already a provider of that insurance company, the insurance company has the right to use alternative benefits. Okay, the last part of building your insurance profile is that you want to find the network recruiters for each PPO plan, especially if you're looking to join a PPO plan or negotiate an existing fee schedule. The network recruiters or network managers are likely the folks that will help you negotiate the fees. Now, most of these folks are already knocking on your door. Network recruiters, for those of you that are not signed up with PPO plans, they will hound your front office. They will even hound you as a dentist and try to meet with you and try to convince you to join their plan. But the little known secret that we'll talk about later about the motivation behind network recruiters and them wanting to get you to sign up with their plan is that there is a financial tie. There are goals and there are quotas for them to meet in order for them to get additional compensation by having you join their PPO plan. We'll get to that here in a little bit, but step number 4 of building your insurance profile, or part number 4, is identify the key players. Okay, let's do a quick recap, folks. Step 1, build your insurance profile. Organize a list of plans that you are currently contracted with, the direct contracts, and then identify PPO plans that you may want to join based upon the feedback from your staff members. Remember to find your top 30 most utilized procedures and throw in the alternative benefit procedures to that list for negotiating purposes. And then finally, try to find the key people at each PPO plan to deal with. Step number 2 is identify leverage. Most dental practices tell me, geez, I am a solo practitioner. There are over 200 dentists practicing in a 5-mile radius of my practice. There is just way too much competition. I don't have any leverage. I'm not going to have the time today to really dive deep into leverage for solo practitioners, but for those of you that are solo practitioners, don't be discouraged. There are some things that you can do or some resources that you can tap into to lease somebody else's leverage in order for you to have effective negotiating. Here are some key leverage items that may apply to some of you. Number 1, if you practice in a rural community, rural dental practices are typically paid higher than the nearest metropolitan area. Specialty, if you're a specialist, you're likely to be entitled to a higher fee schedule. And then availability. If you're a general dentist or a specialist that practices in an area that's for the most part considered underserved, or if you're the only dentist in that area, there's a good chance that you can negotiate a fee schedule with any insurance company out there. Now, once you identify your leverage, finding your leverage is key in order for you to draft an effective initial negotiating letter to send to the insurance company to initiate the negotiating process. Now, a lot of you might be thinking, I'm not a group practice, I don't produce $25 million a year, or I don't produce $10 million a year, so therefore I don't have enough to bring to the table. Well, I'm here to tell you today that there are some things that even solo practitioners can do to obtain sufficient leverage to negotiate with insurance companies. If you're a solo practitioner, visit our website, give us a call, and we can discuss those things with you in person. One key item of leverage that the insurance companies have over all dentists is the McCarran-Ferguson Act. Now, the McCarran-Ferguson Act was a law that was passed back in 1945. This law essentially exempts insurance companies from antitrust. And what does that mean? That basically means that the insurance companies can share information with each other. They can do things on their end that you can't do on your end. An example of that is you can't go to your study club and initiate a collective bargaining agreement with your group. You can't go to the ADA and have them initiate collective bargaining on behalf of the ADA members in your district. That is against the law. The McCarran-Ferguson Act essentially gives the insurance companies a little bit more leverage than you when it comes to competition. Now, some of the solo practitioner leverage, if you're in a rural location, if you have a unique reputation, even if you practice in the city, unique reputations, they can be effective if you use that reputation to your advantage, or if you're true fee-for-service and those insurance companies have been targeting you for years. Again, what we can't do is we can't do the study club method and we can't do class action when it comes to fees because it's just against the law to do that. The large group practices get more attention from insurance representatives. The main reason why is the large group practices have more dentists joining their practices and more dentists needing credentialing. And so therefore, a lot of the insurance representatives frequently visit the large group practices, sometimes on a weekly basis, sometimes on a monthly basis. But the fact of the matter is that the large group practices that do $25 million or more per year, or even $5 to $10 million per year in total collections, those are the practices that have sufficient leverage to go ahead and negotiate with insurance companies today. Okay, so let's get into step number 3, the negotiating table. Now this step here, I think is one of the most difficult steps because finding the right person to negotiate with at each insurance company can oftentimes be difficult. Now, if you think about it for a second, folks, for those of you that have tried to call the 1-800 numbers, sometimes you're routed to India, sometimes you're routed to the Philippines. The insurance companies do this for a couple of reasons. Cost is one of them, but I believe they do this to frustrate your staff members and frustrate you. Think about it for a second. You call the 1-800 Provider Relations Department and you get routed to somebody in a different country that you can't understand. Do you think that's by design? I think so. Or for those of you that may know the dental directors, the director of finance, the vice presidents, the presidents, do you think these folks here want to give you an increase? I don't think so. These folks here are compensated on bonus structures based upon how much money they can save, meaning how much they can save in the form of discounting your current fees. Now, the main folks you want to focus at each of the insurance companies are the mid-level management folks, the network recruiters or network managers, or the retention specialists. Now, the little-known secret about network recruiters is that network recruiters have a quarterly bonus that's tied to the amount of new dentists that they sign up to their plan during that period. Retention specialists, on the other hand, are also incentivized to maintain and retain as many doctors as they can in their region. Meaning when you call to terminate your contract, the retention specialists, their job is to make sure that you don't terminate their plan. And some insurance companies do have a retention department to prevent doctors from leaving the network. Now, I'm not saying that the termination or the boycott method will work. The boycott method, for the most part, for individual doctors may not work. So don't try that as an initial attempt to negotiate with insurance companies. But for those of you that are looking to sign up for PPO plans for the first time, understand that when you join that PPO plan, you're a number to that network recruiter. You're one more number to that bonus or that quota. For those of you that are already signed up with a PPO plan, well, it's possible that a network recruiter helped you sign on, and that network recruiter will likely be the person for you to talk to about negotiating fees. One key point about sending negotiating letters and negotiating with insurance companies, if you don't have an expert negotiator, the only other solution for you to be successful or gain some level of success is for the dentist to be involved in the negotiating process. This is probably the biggest key to success for solo practitioners, especially those of you that may have the time to do this, is that you really have to get involved in the process. Now, when you write your initial negotiating letter, or once you get to the point of brainstorming on how to get the attention of the insurance company, one simple thing that I will share with you is put yourself in the shoes of the vendors that are trying to get a hold of you. I think a lot of you do a great job at having front office staff members that serve as gatekeepers to prevent vendors from knocking on your door. You just don't want to be bothered by the vendors. Well, put yourself in the vendor's shoes, because there are gatekeepers that are equally effective at the insurance companies that will prevent you from getting to the negotiators. But the objective of the initial negotiating letter is that it needs to be powerful enough for it to reach the actual person that will do the negotiating for you. One thing I'll mention about the doctor title, and the reason why the doctor getting involved in the negotiating process works, is simply because most doctors don't negotiate. For dental practices that have attempted to negotiate, almost 99% of the time, it's the front office staff members that have initiated the negotiating process. And nothing against front office staff members. Front office staff members can be key and effective in assisting during the negotiating process, but the doctor title is important because at the end of the day, if you are already contracted with that insurance company, ultimately it's your responsibility to negotiate the fees. If you're looking to contract with an insurance company, you'll get more respect when it comes to fee schedule negotiations if you get involved in the process. The question is being able to set aside time during your busy schedule to get involved in this process. Here are some real statistics of doctors that we've tracked and that we've worked with, that we've coached. Staff members have a 12% success rate with negotiating with at least one PPO, and that 12% of effective staff members get increases anywhere from 2 to 5%. Doctors that we've worked with, 100% of them are successful negotiating with at least one PPO, and the increases are far greater than what the staff members have received. And you're looking at 10 to 40% increased fees when the doctor gets involved. That is the real key for success for solo practitioners, is that you have to get involved in the negotiating process. You have to answer the calls, you have to respond to the emails, you have to send the letters and sign them in your name. The negotiating has to come from you. And that may sound elementary, but it is so true because we've been tracking this for years. Okay, let's get to step number 4, initiating the negotiating process. Now, when you write your initial negotiating letter, you want to make sure to be kind. I'm not a big proponent of sending a letter that comes off as a bully. The bullying method, especially in this day and age when bullies are frowned upon by society, when you write your negotiating letters, I will tell you that when you're kind, when you're diplomatic, when you're patient, and when you understand that that person that you're writing this letter to also has emotions, you're not sending this letter to a robot. That person also has kids. That person also has problems. These are real life people. If you can relate to them on their level, you will get their attention. Now, if you're mean, you'll have a tough time trying to get a hold of them. When you send your negotiating letter, after you've written it, you want to make sure to create a paper trail when you send this. And the main reason why is because you need to be able to track whether that person received the communication. Email is an effective way of creating a paper trail. Certified mail. Fax, somewhat okay, but not necessarily reliable. When letters are sent, a 72-hour response time or 3-day response in writing is requested. And the reason why is you want to hold that person accountable and make sure that that person responds in a reasonable time. 3 days, at least a minimum of 3 days, is considered reasonable. The third thing, folks, is you want to be persistent, but you also want to remember to be polite. We use different negotiating methods, and the kindness method definitely works. Those that are mean, that are unkind to these representatives, those representatives will simply ignore or shred those letters. Okay, the second part, folks, once you've submitted your negotiating letter, and this section here should probably be done right away, is you need to review your office fees. My opinion is that office fees should be set at least at the 80th percentile. The ADA says that percentiles as it relates to fees in the dental industry is not the same as the percentiles as it relates to a college exam. Meaning, if you're in the 80th percentile, that does not mean that you're 80% higher than the rest of the dentists that practice out there. 80th percentile essentially means that you're within 80% of the maximum charge for that area. So don't be afraid to raise your fees to the 80th percentile. The reason why the 80th percentile is important is because insurance companies will ask you for a copy of your office fees. Most insurance companies will shave off a 25 to 30%, sometimes a 50% discount off of what you charge in your practice. And the math is very simple. A 25% discount off of the 80th percentile is richer than a 25% discount off of the 60th percentile. Now here's a chart that the ADA published back in 2009. These numbers are still true today. About a third of the doctors out there don't update their fees regularly. If insurance companies are going to increase or downgrade their fees annually, you should do the same. Here are resources that we can endorse on places to go to review fees. My favorite is fairhealthconsumer.org or feeestimator.org. Fee Estimator is Fair Health's website. I think it would be important for you to Google Fair Health, find out who Fair Health is. Fair Health is such a phenomenal organization. A short summary about the history of Fair Health is that Fair Health is a consumer protection organization. They put information out to help consumers identify what's fair for both medical and dental procedures. And to learn more about that, visit the Fair Health website or Google Fair Health and you can find out more on the web. But when you get to this website, fairhealth.org, click on dental, and then when you get to dental, put your zip code in and then put your procedure code in as well. So this is an example. It'll take you to the next screen here, ask you if you're insured or uninsured. And then the next screen will tell you what the estimated charge is for a porcelain crown in this area. And you can look for any procedure code on this website. I think this website will only give you 12 free searches per month. Then the feeestimator.org is actually a paid website where you can obtain a fee schedule analysis. We don't work for Fair Health, but we're big fans of what they do, and we believe that this is good information in terms of identifying where the 80th percentile is. Now this paragraph here to the right basically tells you that this fee here is the 80th percentile in this area. Now we work for a lot of dental practices in this area, and sadly, most of them are below the 80th percentile. A lot of doctors charge $950 for a crown in this area, at least for this crown. But this should at least give you a general sense of where to start. One thing I'll mention to close on this section here is that we've had 4 major insurance companies willing to offer this procedure code at $1,000, and a lot of these dental practices were at $950, $50 below what the insurance companies are willing to pay. Whether you agree with this or not, the fact of the matter is that the insurance companies are willing to pay more, but the lower your fees are, the greater the discounts will be. Step number 5, reviewing negotiated fees. Once you receive the first proposals, I will tell you that the first proposals are not always best. They're designed to be low, much like when you purchase a car or try to negotiate on a house purchase. The first offers are always low, and the reason why is because the insurance company is expecting you to negotiate. Most doctors don't, they just accept the first offer. I'm here to tell you, don't ever accept first offers. Review the top 30 and submit a counterproposal. Make sure to always pay attention to the downgraded codes because those codes can mean a lot of additional revenue to your practice if you pay attention to them. Here's an example of an actual negotiating setting for a practice in Mesa, Arizona. You can see here where we started. What I want to point out to you here is the porcelain crown. We got a $250 increase on this porcelain crown. We got a $390 increase here on the base metal crown. The crown code that mattered the most in this negotiating section was this one because it was at $490. Okay, fast forwarding to the fillings. The objective of this negotiating setting was we wanted to make sure that the 1 surface, 2 surface was at least close to the composite counterpart. So you see here that we started at $81 and we ended up at $118 on this 1 surface amalgam. We also ended up at $118 for this 1 surface composite, the posterior. So when you match these procedure codes, you won't always be successful at getting the exact fee for both of these procedures, but you can come close. And the insurance companies, some of them will allow you to come as close as you need to be in order for you to accept a reasonable fee schedule. But that's an example. This is an example of a real negotiating setting, folks. Okay, step number 6. Accepting negotiating fees. As soon as you've gone through at least 3 or 4 counter proposals and received 3 or 4 offers, When you accept fees, it is very important that you receive an official copy of the fee schedule, that you also receive an effective date in writing from that insurance company, as well as an expiration date. Some insurance companies won't even disclose their expiration date. And the reason why is because they don't want you to know when that fee schedule is going to be downgraded. But it is important for you to receive the expiration date for the purpose of preparing for future negotiations. Now here's a real example of what fee negotiations have done for an $820,000 practice in Mesa, Arizona. The annualized increase for this practice, negotiating with these insurance companies here in this box, you see here that this box, United Healthcare, Total Dental Administrators is a small local insurance company in the state of Utah and Arizona, but all these major national carriers. You see here that Delta Dental, MetLife, Blue Cross, United Concordia, not even listed here in the negotiations. That represented 44% of this practice, those major four insurance companies that I listed. But all these other companies represented a $90,000 increase for this dental practice. Imagine if this doctor were able to negotiate with at least MetLife or United Concordia, but even without negotiating with those big players that don't negotiate in this area, I think this is a lot of additional revenue that this guy can put in his pocket and say, hey look, that was worth the effort. Okay, the last step, folks, is that you want to track and monitor claims. What I advise folks to do is that once you receive a negotiated fee schedule, audit 5 random claims from that insurance company every month. You want to make sure that they're paying you on that fee schedule. What happens frequently is that doctors will negotiate a fee schedule, the insurance company will pay on that fee schedule for 1 to 2 months, and then they'll start to go back on the old fee schedule on random procedure codes. Whenever they do that, it costs you money. And it doesn't take a whole lot of time for you to sit down or have one of your staff members sit down and make sure that the EOBs match what the insurance company promised to pay you on the new fee schedule. Do 5 random claims per month. And if the insurance company is not paying on that fee schedule, you have a contract in place that you signed, the insurance company signed, that you can hold them accountable to making sure that they pay you on the higher fee structure. Folks, we're going to review the steps. That was it, but let's just review real quick. Step 1, conduct a SWOT analysis on your insurance department. Step 2, this is key, folks. A lot of you may not even have sufficient leverage on your own, and that's when you need to pick up the phone, call us, or visit our website, or at least email us to help us help you identify your leverage. Step 3, get to the negotiating table. Step 4, initiate the negotiating process by sending an effective letter. Make sure that you don't be a bully. Be kind when you write those letters. Step 5, review negotiated fees. Step 6, accept the fee schedules and make sure that's done in writing. And then step 7, audit 5 random claims per month just to make sure, and do that every month. Don't just do that for the first few months. Do it every month just to make sure that the insurance company is paying on the fees that they promised to pay you. I'm going to close here, folks, with something that's very important. When it comes to negotiating fees, there is a lot more involved than what we just discussed today. Give us a call. Visit our website. We don't want you to fail during this process. Most doctors that watch this seminar, they go and they try to negotiate on their own, despite our advice to give us a call and let us help you, and they fail. A lot of them fail. They get discouraged, and they think, well, that was some great information, but it didn't get anywhere. Folks, everybody can be successful at negotiating if you have the right tools and resources. The second thing I'll mention is that the government takes antitrust very seriously when it comes to fees. You don't want to get yourself in trouble. I recommend that doctors at least Google Antitrust in Dentistry, American Dental Association. This is the direct link to that booklet. This is about a 35-page document that outlines the law when it comes to antitrust in dentistry. Antitrust in dentistry is all about fees. Essentially, you cannot enter into collective bargaining. You can't pull more than just you in the negotiating setting. You can't walk down the street or walk down the hall to a competing dental office and knock on their door and say, hey, what's Cigna paying you? What's Aetna paying you? What's Delta Dental paying you? You can't do that. That is against the law. And I have personally seen doctors get in trouble because of the collective bargaining method that is so prevalent in our society. But folks, you have decisions to make today after watching this video. If you really think about your decisions and put your decision into perspective a little bit, if you think about degrees, 2 degrees at 1 foot, that's less than half an inch. At 1 mile, 60 yards, which is pretty insignificant, right? At 1,300 miles, that's 28 miles. Back in 1979, Air New Zealand Flight 901 took off from New Zealand, and this DC-10 took off with a bunch of tourists, and their goal was just to circle Antarctica, circle Mount Erebus, and just to have a sightseeing tour of Antarctica. The problem was, back then, the pilots didn't have all the bells and whistles, didn't have all the indicators that airplanes have now. So what happened was the pilots set their course just 2 degrees off. The end result was that they ended up 20 miles off course. And the sad thing is that they slammed right into Mount Erebus. They were off just by 2 degrees. Pretty amazing, isn't that? Well, folks, you can be off by 2 degrees when it comes to negotiating fees and get nowhere. That's just the simple truth about dealing with insurance companies. You already know that dealing with insurance companies is a very difficult thing. Our message to you today is to give us a call. Let us help you negotiate with these insurance companies. Let us coach you. Let us advise you on what's effective and what's not effective. Folks, it was a pleasure. Thank you for watching this presentation and have a great day.